So, I finished my little procedure a few hours ago. It's 4 p.m. right now. I got to the hospital at 5:30. Went through admittance and all that stuff, and they started me on a preventative antibiotic IV. Had to run like an hour and a half before I could do anything. I'm just going through all this stuff. They finally put me under around 7:30 a.m. about 2 hours after I came up here. After I got to the hospital, then surgery was about 3.5 hours or so, maybe a little longer. Apparently I haven't talked to the surgeon myself yet. I'll probably see him tomorrow. Oh, my blood pressure cuff is making sure I'm not dead. Wonderful. So my surgeon told my girlfriend that it was a lot more ugly or messy or something in there than they expected, and they had to do a lot more work. Curious to see what the details of that entailed, but I've bled a good bit for this procedure. They said I lost about a liter that they recycled through, and I'm still doing a lot of oozing. I have my little oozed suction device. I've already emptied once. So yeah, the joys of the hospital. I've got Kylie just left to go take care of my dogs, one of which is sick. I feel horrible for her, having to take care of a sick dog and a busted up boyfriend. I've got my TV, thankfully. Star Trek's on. Woohoo! I need one of those the little woo 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 thing that just makes me magically better. But all in all, Kai was kind of upset that I came out of anesthesia so quickly, and she didn't get an opportunity to record me saying or doing any really goofy things for her. So I went ahead and made her a video she could have, just for the satisfaction that I really wasn't loopy. And right now I'm awake. Saying my blood pressure, they're concerned about my blood pressure being low. They don't want to get me up and walking until my blood pressure comes back up. But so blood pressure needs to come up, then I can get up and do some walking. Right now it's just pain. It feels like somebody cut out a whole bunch of my spine and replaced it with a bunch of metal parts, which is kind of what they did, so I guess that's expected. But as far as the pain goes, it kind of feels like pre-op when I would sleep too long and just have horrible pain that I couldn't stretch out. You just can't get comfortable no matter how you rutch around. For those of you that don't know rutch, that's a Pennsylvania Dutch term, I believe, for fiddling and wiggling and being ants. Ants being rutchy might be described as having ants in your pants, perhaps. I don't know. I have a silent H in my last name, so I'm allowed to use it. go Amish. Anyway, that's about it for now. I'm really hungry. They supposed to get me some broth and stuff, but my throat's pretty scratched up from the tube as well. But all in all, it was a so far uneventful day as far as I know. Cut me open. I guess they said it was a little more complex, but cut me open, and now I'm sitting here, oozing and in pain, and they're forcing some extra fluids in me to try to help get my blood pressure back up. But, could be a lot worse. It's uncomfortable, but big thing is it's really hot in here. And I've also got my lovely pantyhose, my lovely support hose that, woohoo. I don't know how you girls wear this crap in them skirts. These things are hot as hell. Maybe that's why I wear them. I don't know. But yeah, that's my note for now. All is well. So long.